The Facial Nerve Disorders Committee of the American Academy of Otolaryngology, Head and Neck Surgery has adopted a universal standard for facial nerve grading. It is intended for use when a patient's facial nerve recovery is being assessed. This system involves a 6-grade system from 1 to 6, grade 1 being totally normal and the patient with grade 6 having total flaccid paralysis. The patient in grade 1 has normal symmetrical movements of all branches of the facial nerve with good eye closure, smile, and symmetrical raising of the eyebrows. These patients that you are going to see have various degrees of facial nerve impairment. They have been asked to raise their eyebrows, close their eyelids with minimal effort, maximal effort, and try to close the eye on the involved side. They've also been asked to raise their nose and to smile. The second patient represents a patient with a minimal facial weakness on the right side. This patient falls in grade 2/6. You will note that she has good eyebrow movement and is able to wrinkle her forehead. On a closure of her eyes with minimal movement, she is able to close both eyes, but the right eye is slightly weak, and you'll notice that there is a slight asymmetry. In this case, there is also slight synkinesis. We feel that a very slight synkinesis is not unusual, even though the facial return has been quite good. You will notice at times when she smiles or when she tries to close her eyes forcibly that you will see a slight movement of other divisions of the facial nerve. The next patient has a more noticeable deformity. Now this patient falls into grade 3/6. She is able to get some movement of her eyebrows when she wrinkles her forehead. With minimal effort, she is able to almost close her right eye. With maximal effort, she gets good eye closure, but you will notice that there's a moderate degree of synkinesis. With this maximal effort of closing her eye, the right corner of her mouth also moves. She gets a fair degree of movement when she wrinkles her nose, and she has a fair movement of her lips. You'll notice that there is a fair degree of mass action in this patient, but this patient falls into grade 3 because she still has some forehead movement. Now when a patient lacks all forehead movement, such as this gentleman who's not able to raise his left eyebrow at all, then they fall in grade 4/6. Grade 4 represents a patient who has had complete degeneration of the facial nerve and therefore has a rather marked degree of disfiguring facial weakness following recovery. You will notice that with maximal effort he was able to completely close his eye on the right side. You'll notice that even at rest his face pulls over to the left side, indicating that there has been some facial nerve spasm. It is generally difficult to differentiate between grade 3 or grade 4, and so the key point is to be sure to look at the forehead. Now this next patient has a rather marked degree of right facial weakness. He falls into grade 5 because he is not able to close his eyelid completely. He has no forehead movement. He has so much facial weakness that he really doesn't have synkinesis or mass action. The reason for that is he has not had enough facial return to even have the secondary defects. He does, however, have good facial tone, and on careful inspection you will see some slight movement of some of the muscles of the right side of his face. So this system then allows us now to categorize these patients in various general groups. This last patient has a total flaccid paralysis on the right side. This patient has no movement of any of the divisions of the facial nerve. She has very poor facial tone even at rest. So this patient therefore falls in grade 6. So this system therefore involves grade 1/6, 1 being normal and 6 being a total flaccid paralysis. A patient with slight asymmetry would be in grade 2, and a patient with barely visible facial movement would be grade 5. A patient who has a moderate degree of disfigurement but does have forehead movement is grade 3, and a patient with no forehead movement and a moderate or moderately severe degree of facial asymmetry would fall in grade 4.